Liposuction, big part of your practice?
Big part of my practice. It's a very common operation that a lot of people ask for, both men and women, really of all age groups. It's a very, very popular
What is
procedure.
the most popular liposuction procedure for men and women?
For men, it's the neck under here and the stomach, that spare tire that kind of comes all the way around us. For women, it's mostly the tummy, the hips, the outer thighs, and the inner thighs. The scope or the goal for women is to create kind of this straight, beautiful look rather than this overtly curvy look in the thighs and the hips.
How have things changed with liposuction in the past 10 years?
There's a lot new with liposuction. The technology has really evolved. We've gotten much better techniques where we put local anesthetic in so that the person heals faster, has less bruising, less swelling. It really is a lot easier to recover
What about the
from.
blood loss, I've heard?
The blood loss is minimal now because the cannulas or the actual instruments that we use are very delicate, very small, very smooth and rounded at the ends. So we're doing it in a much less traumatic way, in a much quicker way. People go home, they don't go to the hospitals. It's a very easy, very quick, very fast recovery.
So downtime, could somebody go in on a Friday, have their love handles removed on a Friday, and possibly go back to work Monday?
Absolutely. We do that all the time. They'll come in Monday morning, I'll take a look at them. If everything looks okay, boom, off to work they go. They'll be wearing some type of garment or girdle, something like that, which is fine. They can wear some loose clothing, but they'll feel well, they'll be relatively active, and they can do their work.
Okay, what are the other areas of the body you're doing? What about the arms with women?
I do a lot of arms in women, particularly this area up here where they just can't control it by dieting or exercise. If I can do it young enough where the skin is good enough tone in that area, it contracts and it protects that area.
So it'll pull back
worse.
up.
It does. The skin is smart, and in a young person, the skin really has the ability to tighten and contour and make a beautiful shape to the arm.
So 35, 45 years old, what's a good time?
Easily. And the arms I've done up to in the 50s. And it
So
works
women
really
are
well.
wearing short sleeves again?
We want women to get into short sleeves. We want them to be proud not only of their chest, but of their figure in general, their arms, their legs, to get them into shorts, to have them be comfortable being out in public in pretty clothes.
What about the saddlebag area? How well does that treat?
Saddlebag is a great area for women. It's good because it's very common, it's a very popular area, the skin tone is pretty good, and we're able to really create not only just how well they look in clothing, I want them to look good in a swimsuit. I want them to go out and be proud of how they look, both in clothing and not in clothing.
What other areas of the body are you doing liposuction?
We do the back a lot also. We can actually take the patient now, mark them appropriately, put them on their tummy while we're doing the surgery, and create a lot of sculpting effect in the shoulders, under the arms, and the back of the arms, and the central back, and the waist as it comes around.
So that fat that I see around the bra straps on some women, you could get rid of that?
And if they've had, the answer is yes, and if they've had good liposuction everywhere else, it's a terrible deformity because they still can't wear the things they want to wear. It's very important to get that. If it's a problem, we go very aggressively after.
What about knees, inner thighs,
Yes.
buttocks?
Yes. I'm not a big fan of doing too much in the buttocks because we've learned that there's problems with the skin not contracting and falling a little bit. So it has to be very carefully done, very thoughtfully laid out. Mostly the upper buttocks, the knees I do, the inner and the front
Is
of
that
the
right,
knees
the
very
knees?
adequately. Very common place to do. Inner thighs, very common. We even do calves all the way down to the ankles, of shaping the lower leg and really making that part of the leg look beautiful too. What women want to do is they want to feel and look thin, and they want to look straight. They don't want all this curvy stuff. So our job is, if we can make the leg look straight, they look thinner and they look taller. And it's very sexy to have that open space in between the legs, not rubbing. So if they're in their tight jeans, their leather pants, they look great.
What should somebody look for in a surgeon that's going to do liposuction?
A lot of different types of surgeons do liposuction, and I would encourage the person to really go into the qualifications that it's a board-certified plastic surgeon with the American Society of Plastic Surgery, and that he does a lot of that operation. It is one of those things that the more you do, the better you are at it, and that technically you want someone that's very adept and very good at it.
Back to men again. The neck.
Yes.
Somebody goes in on a Friday, can they go back to work Monday?
Tuesday. I'll see them on Monday. If everything is great, they'll go back on Tuesday and they'll look fine.
Great results with lipo on the neck? You
Great
catch
results.
it early?
Great results. If they're young enough that they have good skin tone, it'll tighten up. It saves a lot of people what they think they need at a facelift. They just need a little bit of liposuction. Boom, perfect.